option, a private option. How about a cooperative? Is it just like the Canadian plan? Hey, what about the Norwegians?
Woo!
Hey, maybe it'll be just like the Chinese. Swiss have a plan. You bet they do. President Obama losing cred as his health care plan changes yet again. And now a moderate blue dog Dem says they may need to start over and try again. The new health care reform bill. Does Texas Republican Congressman Michael Burgess agree? Sir, you heard the intro. I'm confused. Is it public? Is it private? Is it government sponsored? What in the world is this? Are we just going to wipe the slate clean, start over? What's it going to take?
Well, I think you've heard from the American people this past couple of weeks, and as a consequence, the bill that Democratic leadership thought was going to be the be-all and end-all piece to change health care in this country forever now doesn't look so viable. So maybe it's a good thing that we go back and we try to focus on those things that are clearly important to a lot of people, and that is helping people deal with the pre-existing condition problem, helping people deal with insurance rescissions. But we don't have to turn the entire system on its head when it's working well for 60, 70, 80% of the American people. And that's kind of what we're hearing about in our summer recess August town halls.
Representative, I mean, you say it's working for 60, 70% of the people. I might take some issue with the satisfaction rate that you're claiming there. But at the same time, I think we all do know that there has to be some reform. Everyone's saying we've got to do something in order to help the people that aren't able to tap into health insurance right now. My big concern is I don't have any more faith in the Republican guys who are owned by corporate interests of the insurance companies and the hospitals, et cetera, than I do with the Democrats who are owned by the very same companies. What is it that you guys are going to do that the lobbyists are not going to own you anyway?
Well, again, I think the key here is you've heard from the American people over the past couple of weeks in a way that you hadn't heard from them in this debate before. And the fact that they're being listened to by networks such as yours and being listened to by the other networks. These clips are playing endlessly on YouTube, and people now are getting the message that what Congress perhaps had in mind was not fitting well with the vision that the American people had for their vision of the future of health care. Now, when we get back to Washington in September, maybe cooler heads will prevail. Maybe there is a way to sit down and talk about how do we provide some protection for people with pre-existing conditions, how do we provide for people who've had a tough medical diagnosis, and not disrupt the system for those whom believe it is working well for them. That's really the challenge. The president said it out early on. He said, if you like what you have, you can keep it, and the only thing I won't accept is a status quo. But regardless of the percentage you put on it, if you've got 60, 70, 80% of the people who like what they have and want to keep it, by definition, that's the status quo.
Representative, Congressman Boyd said at his last town hall meeting, he was actually asked by one of his constituents, should we throw this whole thing out and start over again? And Congressman Boyd said, I think that's an excellent idea. That's where we might end up. Is this really a possibility?
Well, forgive me for agreeing with one of my Democrat counterparts, but that does sound like the best idea. And here's the deal: even the rank and file Democrats were cut out of this process right from the beginning. Certainly, the Republicans were. This was a bill that was written in secret by 3 Democratic committee chairs who've been there for each one since 1974. It really had no bearing on reality. So it's no great surprise that the rank and file member of Congress, be it Republican or Democrat, is having some problem with this, and it's no surprise at all that the American people have voiced their displeasure with this bill as they've had more and more chance to look at it.
Representative Burgess,
the Democrats did us an enormous favor by slowing this down.
I want to show you something. Here's my notes for Street Meet. I'm going to talk about this a little bit later, but President Obama came out of the box saying that a public option was crucial and imperative, and now all of a sudden it's not so crucial and certainly not imperative moving forward. Here's the question. Last night I interviewed Vic Schneider, Representative Democrat, who said, I asked him, is this a situation where I can buy health insurance in New Jersey from a company in Maine? And the gentleman was honest enough to look me in the eye and say, look the camera in the eye and say, I don't know. What about it? Can I buy insurance as a New Jersey resident from a company in Maine?
Well, today you cannot. If we do the public option, then yeah, but it'll be the public option that's available in both New Jersey and Maine. But why not give that freedom to the average American today? We have that within our power to do it, and yeah, that is one of the things that we could be doing right now to bring the cost down. I had a forum this afternoon for small business owners in my area. I put it up on my website, which is healthcaucus.org. I heard from a lot of people who have concerns, just as you have just voiced. And that's one of the relatively easy things that we can do to help bring the cost down for people.
Representative, what's the simple, best one thing we got to do in order to help the healthcare system? If you could pick just one thing to fix, what would that one thing be?
Well, I personally like the consumer-directed health care plans. I mean, I've had a health savings account or medical savings account for a long time. I think when you put the power in the hands of the patient, the purchasing power, the money in the hands of the patient and the doctor make better decisions than any one of us in Congress can, than really anyone in the state capitol can. These are important decisions that are individual, and they belong in the purview of the doctor-patient relationship. They don't belong to the insurance company. They certainly don't belong to the federal government. My bias would be the more purchasing power we can give to the individual, the better off we're all going to be. It's this price insensitivity that is just built into the current public and private plans that none of us are really cost-conscious health consumers.
Yep. Thank
All
you,
right.
Congressman.
Important points you made. Thanks, Congressman, for joining us on Happy Hour.
Thank you.
All right,